Hey guys, welcome to my video. My name is Matthew Pieper. I am doing my presentation on spinal precautions as well as educating how to complete portions of dressing tasks after you have spinal precautions. So for the first question, what are spinal precautions? These are basically a list of restrictions that are given to you after you have a spinal surgery, whether that be a laminectomy, a lumbar fusion, discectomy. There's multiple spinal surgeries that you can have, but typically after any single type of spinal surgery, you're going to have a list of restrictions that you need to adhere to in order to make sure that your spine heals correctly. Usually, these are set by your orthopedic surgeon and they last for different lengths of time. For most patients I've worked with in my experience, they typically have had them for between 8 to 12 weeks, sometimes longer. It depends on each person. It also depends on the orthopedic surgeon and how conservative they are. Um, so, for the main restrictions that most people are going to have after a spinal surgery, it's broken down into a few things. You are supposed to avoid bending, lifting, twisting. Typically, also, they want you to avoid doing pushing and pulling. Basically, let's break it down for you so you can think about this in each individual step. So, for the B, no BLT, right? So, for B is bending. The reason why you can't bend, and bending usually encompasses you bending with your spine to bend forward. It encompasses you reaching down to grab items from the floor, put clothing on for yourself. You don't want to bend because your surgeon wants you to have your spine in a very neutral alignment while it's healing. If you were to flex forward during that healing process, you can make some of the hardware they put in there shift. You can make the surgery site itself um, become compromised. If there's arthroplastic, like a fake disc that they put in there, or if they've done any sort of a fusion and you flex, it could cause things to pop out of place. It's also extremely painful. You're not going to want to do it anyway, but it does happen sometimes. People make mistakes, and if that were to happen, your surgeon may have to go back in again and do a revision on your back, which is not fun. It increases the risk of you getting another infection. It also can cause you to develop excessive scar tissue in your back where you may not have any normal movement ever again. So the bending portion is very important to adhere to. The other part is the lifting. So the surgeon will typically tell you nothing between like 5 to 10 pounds. A lot of times, most surgeons will limit it to 5 pounds. We tell our patients quite frequently to think about don't lift anything heavier than like a gallon of milk, which you're not going to want to lift a gallon of milk anyway. After a spinal surgery, it's quite painful. Anytime you pick up an item and you lift something, you are loading weight down through your spine and it's very uncomfortable. It causes a lot of shooting pain. So again, no lifting, so you're not going to be able to carry things across the house, nor are you going to want to. Most people are going to be using walkers anyway, so you can't really carry stuff in your arms. Um, but that's a very important one to adhere to. Even the slightest amount of lifting is going to probably cause pain. I've even had patients in the past tell me if they tried to reach for maybe like a heavier mug out of their cupboard or something like that, that it causes some type of shooting pain down their spine. It's very uncomfortable. So again, you're going to have no lifting, no bending, no lifting. The lifting restriction is usually set by your surgeon, and you'll be cleared of the lifting restriction when your orthopedic surgeon clears you. The next part, the T for the new BLT. The T is the twisting. So the twisting encompasses any sort of movement where you're reaching across your body to grab items, where you turn your body to the side, either direction. Those movements are not allowed because it causes the vertebrae in your back to rotate. When you're reaching across your body to grab things, or you reach across maybe even to grab like a light switch, something simple like that, you can't do any of that during the healing process after your spinal surgery. So those are all contraindicated. The other portion that typically is added on as well is no pushing and pulling. Again, that encompasses basically you're not really doing any lifting, right? So if you're pushing something, you're probably pushing something that weighs more than a few pounds. And that typically for most patients will cause a very strong pain response. Um, and then pulling's the same thing. If you can't lift anything, even if you're grabbing something, you're trying to pull it to you, you need to protect your spine. And if you're pulling anything that requires any amount of effort, it's not good for your spine while it's healing. And in general, you're going to get a lot of shooting pain. It's not going to feel very comfortable. So again, let's revise these again so it's easier for you to remember. We tell a lot of our patients think about a BLT sandwich, right? So no BLTs and then no double-sided pickles for the pushing and pulling. Now the other portion of some of the spinal precautions that we need to tell our patients is that you do need to make sure that you're changing your positions frequently. It's very difficult because you have a certain amount of restrictions for your recovery process after a spinal surgery for people to stay active. So they are spending quite a bit of time down, either laying in bed or they are sitting, which is okay. You do need to heal. However, you have to change your positions frequently, especially sitting. If you sit for an extended period of time, sometimes for patients, if it's longer than 30 minutes, they're going to be in a lot more pain. So you do need to make sure you're changing positions between every 30 to 60 minutes. If you've been sitting in one chair for an extended period of time, you haven't gone up and moved, or let's say you fell asleep and you took a nap, right? If you wake up and it's been about 30 to 60 minutes, you need to change your position. So get up and walk around, maybe stretch your legs a little bit. It's the same thing with laying down. If other than when you're actually knocked out of sleep, if you are spending a very long amount of time just laying down flat on your back, it's not good for the recovery process. It also can affect the healing. So you need to make sure you are changing positions very frequently. Now, for the next part of this video, I am going to demonstrate how to utilize some adaptive equipment that I actually have over here to teach someone that has spinal precautions how to get themselves dressed while adhering to their spinal precautions. These two pieces of equipment, the white piece right there is called a sock aid, and the other piece is called a reacher. Typically, these can be purchased on Amazon very cheaply. A lot of times we tell our patients to purchase what we call a hip kit, and that basically has the the sock aid in it. It has the reacher. It also usually comes with something called a dressing stick that can make it easier to push clothing off of yourself, but you can also use the reacher for that. And then you also can get a long-handled bath sponge. You can get a shoehorn as well. Hip kits usually run about $30. If you want to just buy these pieces individually, you certainly can. So I'm going to go over the first part, which is the sock aid, and I'll show how to use one of those to put socks on in a way that you can do it without bending and flexing forward. Okay, so here's the sock aid. Imagine your foot is going to go in like this, and I'll demonstrate it. Your toes are going to be facing up. You typically take your sock, which I have an ankle sock here. You're going to take your sock aid, and you're going to face the open part towards you, right? Typically, I'll tell people put it in between your legs, your thighs, and then you can do it on your chest as well. You're going to take the sock, slide it on, right? Make sure it's completely flat on top. Don't block these two knots here because that's how you can actually put the sock aid on the floor to put your foot in. And let me move the camera and I can show you guys how to use it. Put it down a little bit so you can see my legs, maybe my feet. So let's back up. All right. So you're going to take your sock aid, go down. You put your foot in. Hopefully you can see that. Put the foot in. Move back up a bit more. Now, as you have it on, you're going to pick your foot up, you're going to point down, and then you pull. And this allows you to put your sock on without even having to flex your spine. So this is a great tool to use throughout your healing process. It can make you a lot more independent, and it's obviously a lot easier to use than having to ask someone for help every single time you're getting dressed. Now, the next tool is the reacher. All right, these are going to be great because as you have these restrictions when you're healing, you can't bend down to pick things up off the floor. If you need to get something that's across from you rather than twisting, you can use this to grab something. And it's also great for getting dressed. So let's use a pair of sweatpants to demonstrate how to use this. So you would take your pants, you can either line them up on you like this and take your reacher and squeeze it, or some people just put it down on the floor. Now you're going to pinch the side of the waistband that you're going to try to dress first. You pick it up a little bit, put your foot in, make sure it's in the right pant leg. I know I already have pants on, so it's a little bit trickier. You pull it up just far enough until you can reach it without having to flex or bend at your spine. Then you can pull up a little more. This type of pulling is not going to be contraindicated after your surgery. However, I wouldn't recommend wearing very tight clothing like this after your spinal surgery. Wear things that are very loose and easy to put on. Now to do the other leg, you can clip on here, you can push it back down, put your foot in, and now you can pull up as soon as you get to a point where you don't have to flex and bend. Pull up as high as you can comfortably go. And then from here, you would stand up, hold over your hips. Now, the other part that people need to be aware of is during dressing tests is you got to make sure that you are not bending down to take your clothing off. So basically, when you're standing, you pull your clothing down to about thigh level right before you need to bend. Then when you're sitting down, you use the reacher, push the clothing off like so until you get to the point where you can maybe use your other foot to pull the clothing off, right? And then do the same thing on the other side. So that's how you get things off without having to flex and bend. These are a little tight on the bottom. Again, I wouldn't recommend wearing tight things. You want to wear things that are comfortable. And you can pick it up without having to bend down. And now you've done your lower body dressing without actually breaking your restrictions. Again, that's super important because you need to make sure that you're protecting your spine as much as possible. You don't want to have to go through the surgery again. Most people are in a lot of pain after a back surgery. And if you're coming along fine with your healing process, the last thing you're going to want to do is have someone else, have to go in again, clean up your spine, fix things, put new hardware in. You want to make sure you are very careful so you can just get through the healing process. And then once you're lifted by your restrictions with your orthopedic surgeons, you can get back to doing your normal movements as tolerated. All right, so those are the dressing parts. Now, the next part I'm going to go over in this video is I'm going to do the log roll technique with you guys. I'm actually going to use my wife to help me with this to make sure that I can kind of verbally talk you guys through it, and she's going to help demonstrate it for us. But the log roll technique is very important because if you were to get in and out of bed in a normal way, most people are flexing and bending their spine. So the log roll technique is a way that you can get yourself into bed safely and get out of bed safely while keeping your spine in more of a neutral alignment. So we're going to do that next. Okay, we're here with our patient, Mrs. Pieper. I'm going to teach Mrs. Pieper how to use the proper log roll technique for getting out of bed, as well as getting back into bed, and then she's going to demonstrate it back. So the first part, Mrs. Pieper, is I want you to make sure that you are keeping your body in almost like a log state. So as the bottom moves, the top moves at the same time. And that is to protect your spine so it's not bending any way that it's not supposed to. So for getting out of bed, the first thing I want you to do is you're going to bend your left knee. Now I want you to try to roll yourself onto your right hip. Perfect. Okay. So now the next part that I want you to do is you're going to bring your legs down at the exact same time that you're pushing your upper body up into a sitting position. Very good. Excellent. Okay. So that's for getting out of bed. Now to get into bed, once you're sitting on the edge of the bed like you are now, you're going to make sure that you bring your legs up at the exact same time that you bring your upper body down onto the bed. So go ahead and work that up. Perfect. Okay, now you're on your side, and now you're going to roll at the same time with your upper body and lower body onto your back. Perfect. Okay, so what I'd like for you to do next for me is I want you to verbalize these steps and show me how to get yourself from this position to sitting at the edge of the bed.
I'm going to bring my left knee up and plant my foot on the bed, and then I'm going to roll onto my right hip, bring my body all as one like a log, and then as I bring my legs down, I'm going to bring my upper body up to sit on the edge of the bed.
Good.
Now that I'm sitting, to get back into bed, I would bring my legs up into the bed as I lay my upper body down into the bed. And now that I'm on my side, I can roll together as one onto my back.
Perfect. Exactly. So doing the log roll technique in this manner is how you adhere to the bending, lifting, twisting restrictions that are set to you. If she were to get up normal, like how someone normally would, and let's say she just sits straight up in bed, go ahead and sit up for us, Ms. Pieper. In doing so, to do this, she is flexing at her vertebrae in her back, which could cause her to injure the surgery area. Additionally, as you saw when she sat up and then she just twisted to bring her legs out, then you're breaking the twisting portion of your precautions. Typically, if you were to try to do this anyhow, like you're going to be feeling the pain. So a lot of our patients are taught the log roll technique before they leave the hospital. But if you have a surgery coming up, it's good to practice it before you actually have the surgery, uh, just to make sure that you are doing it correctly before the surgery. So that's how to do the log roll technique. After those two portions of the video, you should have a good understanding of how to complete the dressing activities using the adaptive equipment. So you adhere to your spinal precautions as well as how to get in and out of bed using the log roll technique. So let's go over our quiz questions to make sure. These are definitely important to make sure that if you are teaching a patient these things, you are going to want them to either demonstrate visual feedback or they also need to demonstrate verbal feedback or both. So let's go over our quiz questions together. All right. The first question is, how often should you change positions? All right, if you remember from earlier in the video, I explained that you should be changing positions every 30 to 60 minutes. Question number two, what are the 5 movements that you want to avoid after spinal surgery? Okay, so those are no bending, no lifting, no twisting, no pushing and pulling. Think of it as a no BLT with a double-sided pickles. All right, question number 3. Here's a quiz question. How far can you bend over to tie your shoes? All right, if you've made it this far in the video, you probably know you should not be bending over to tie your shoes. Either use some adaptive equipment or you have someone assist you to do so. And that is because if you were to bend over to tie your shoes, you're breaking the bending portion of your spinal precautions. All right, question number 4. What technique should you use to get into and out of bed? Okay, the answer is the log roll technique. And question number 5, how much can you lift after a spinal surgery? Okay, the answer for that is you can lift up to 5 pounds, unless your surgeon sets it a little higher, but typically it's always 5 pounds, until you are cleared to lift more by your orthopedic surgeon. So that concludes my presentation today for your spinal precautions as well as how to get your lower body dressed with spinal precautions and getting in and out of bed using the log roll technique. I hope you found it informative. And if you do have any questions, just please reach out to me and let me know.